some of the latest developments in this hospital, or rather the progress that we have made, are one is related to the services that we are rendering to the patients now. The number of patients received by the hospital has increased of late, and our bed occupancy is almost complete all the time. We are finding on some days we even find shortage of beds. So we are looking at putting additional beds in the space that is now available to us without actually cramping the hospital and making the patients feel overcrowded. So we are also looking at actually putting one more block in the fourth floor so that the additional patients can be accommodated. That's one area. The other thing is that the reputation of the hospital is gradually spreading, and so more and more number of poor patients are also coming. That's another thing that I wanted to tell you. Now, on the academic front, we are really focused. This month we will be actually having what's called as institutional review body and ethics committee meeting, and from then we will take forward to conduct latest research in the areas of brain tumors, in the area of breast cancer, and also in prostate cancer. There are at least about 12 to 13 research projects waiting for approvals from the ethics committee. Once that is done, it will all start. Maybe it will take off in the next 6 months. The other thing is, recently we had a visiting professor from University of Missouri from USA, and we are setting up a collaborative research work on nanoparticles with the Missouri University. I think that will take off in the month of October or so, and we are setting up the laboratory at a cost of 70 lakhs in Shankara Cancer Hospital. That is one major growth that we are actually seeing, and it's a promising research. A lot of patients in India will be benefited from that if we can start that research. Yesterday, in fact, I had a meeting with a team of Philips consultants. Our hospital has been recognized for setting up their digital pathology lab, which is going to be a big leap forward as far as the services are concerned. You can actually give better results, better reports at lesser cost, and also at a greater speed. So that is going to make patients' treatment much more comfortable. So apart from this, I must say that the Department of Neurosurgery was started about 2 months ago, but it has come off very well. Now almost every week there are 3 or 4 operations going on, neurosurgical surgery procedures going on in the hospital, and it's attracting a good number of patients. So in the next 4 months, we are planning to set up a national level radiotherapy conference hosted by our hospital. And we have some of the best technology as far as radiotherapy is concerned, and we would like to expose that, and also would like to make sure that all the applications are optimally used for the treatment of patients without wasting both the talent as well as the technology. So in order to do that, we are inviting experts from USA who are actually participating in the conference, and to give us some tips as to how to take it forward and how to improve the quality of care. So these are all the things that we are planning during the next 6 months. That apart, of course, we will have challenges to face, particularly in terms of providing facilities for the patients, for their accommodation in the hospital, and also in providing funds for the treatment of the poor patients. As more number of patients come, more number of poor patients also will come for treatment, and we will have to take care of them, which means additional thrust on fund mobilization and things like that, which is already happening. And another good thing that I wanted to say is that we are not actually facing difficulties in raising funds. The reputation of the hospital is good, people are accepting it, and donors at our request are all the time supportive of our activities, so we are able to see that all the patients receive optimal treatment in the hospital. Yeah. Saka?